Okay, so today we'll be talking about patterns of growth during the adolescence phase. The part one has already been shared where we did an introduction for what is exactly the adolescent phase in terms of the age group, how we differentiate with respect to girls and boys, when is the age of onset of puberty, right? And what are the how do we understand the adolescence period, so to say, its complexities, because it's a very holistic understanding of adolescence that we need to take into consideration, because now the child, or say, so to say, the adolescent is exposed to a wide social environment, a wide peer network, a wide peer group, and that has lot many implications on not just their social health but also social well-being, but also their psychological well-being, their physical development, their cognitive development, their academic performance, and things like that. So adolescence period basically is a very it's a very crucial phase of our life. Also, in terms of the hormonal changes that we have already studied, how the onset of puberty brings out the growth and sexual development phase within a person. That again varies with respect to boys and girls, and how the role of environmental conditions, your diet, your nutrition habit, your even your genetics does come into play in terms of your adolescent well-being, right? Or your adolescent development, so to say. We have discussed about hormonal changes in terms of their physiological changes that are influenced by the hormonal activities, differently in boys and girls, and how the role of hormones is very much organizational in its nature, and it triggers certain physical changes and behavioral changes. Example, the mood disorders and things like that. Eating disorders is one good example. So all these things again is a major influence of your hormonal changes. Then changes at the onset of puberty we have already discussed. Sexual maturation. Now we were talking about the adolescent growth spurt, or the growth spurt that we have observed during the adolescent phase. Now, this was the last slide that I concluded last session. So now when we talk about the growth spurt, basically how do we understand this spurt is a sudden increase, a sudden or a rapid increase experienced by both the genders in terms of their height as well as weight. Okay, now for over 2 to 3 years, there has been a constant release of growth hormones, the thyroid hormones, etc., that play a major crucial role in helping out with the growth spurt. Now, males basically experience growth spurt almost 2 years later than females. For girls, it basically starts within the age group of 8 to 13 years old, until they reach the adult height between 10 to 16 years of their age. On the other hand, boys observe this sudden growth, or the growth spurt, between the age 10 to 16 years and their adult height, until they reach their adult height, that is between 13 to 17 years of their age. The bracket here I'm using, why? Because lot many studies give a different references, quote different age groups where we see these spurts. For instance, if we go by P. Nath book, in girls, if we talk, the depending on like the age of onset of puberty, which is considered 12 years in that book. Therefore, the spurt is basically understood according to that age group. So that again has a reference to it, but because different references, different publications, different articles use different age groups for that, therefore it's better to use that broader bracket instead of going by one particular age, because also we cannot generalize that age for all of us, because everyone have a different exposure to different environmental conditions. We have different hormones in our body, so their role again is very much differently observed in all of us. So that spurt is not regular, or it could not be generalized with respect to one particular age group. Okay, so therefore we use these broader brackets for our reference. Now, these growth spurts are basically depending on two major factors: your nature, and your nurture, as in your genetic composition, your hormonal balances, imbalances, so to say. And on the other hand, your nurture, as in your social environment, your food, your physical activity, and all these things are basically, both the ways are helping out you to get your growth spurts as soon as possible or as late as possible. Okay. Now, before the spurt, before that sudden increase in height or weight happens, males are generally seen to be longer than females, but that difference is only 2%. This reference I'm using from P. Nath book. Now, that difference before the spurt is observed to be only 2%, but after the spurt happens in both the genders, the spurt difference observed is almost 8%. So now you can understand that how influential that growth spurt is in terms of height and weight of both male and female. Now, this difference basically is the result of when that spurt is happening. As we know, it happens 2 years later in boys with respect to girls. So, because it is occurring late in boys and the intensity of spurt is higher, is more rigid in boys versus girls. So, therefore, that difference is quite visible in both the genders. Okay. Now, it is also seen that spurt in height is only or essentially due to the trunk growth instead of your extremities or your overall linear growth. It's just with respect to your trunk growth. The muscle spurt happens about 3 months after your height peak is reached. Okay, so first linear growth is observed with respect to your trunk growth. After 3 months, or in a broader bracket of 3 months, after that there is a muscle spurt, there is a gain of muscles and things like that. More after that, like after 6 months of your muscle spurt or overall height spurt, overall height peak that you have reached after 6 months, only then you will be seeing a increase in your weight. It again is very much different because it also depends on your dietary habit or your availability of food and things like that. So weight gain is also visible with respect to your height peak reached after 6 months. Okay, so these were the few things that you need to keep in mind. Adolescent growth spurt is a very important topic, and therefore you have to it's very important to be understood how that spurt happens. It's not just like one day you are sitting and tomorrow your height is all almost twice what you had yesterday. It's not like that, but within 1 year or within 2 years of a phase, gradually your trunk is happening, your weight is being gained, your height is reaching at a peak, so accordingly your spurt is happening. So that is quite visible, but that is not all of a sudden. Okay, so this was about adolescent growth spurt. Now, when we're talking about the adolescence phase, there's also important thing when we talk about the brain development. Between 10 to 25 years, brain undergoes different changes with major implications on your behavior, like your mood disorders. And if I have to quote few of the references, most of the researchers are studying the role of eating patterns, or within the adolescent females there is a more trend of eating disorders being quite visible these days, or for over last 5 to 10 years. So that is also a major visible implication of your brain development, of your behavioral development, so to say, that happens within 10 to 25 years of your age group. Now at this point, or until you are almost into the adulthood phase, your brain reaches 90% of its adult size, and it's not like precisely during the end, during your puberty till your adulthood phase, or in the late pubertal phase until the beginning of adulthood, that is the phase when your brain is almost reaching 90% of its adult size. Now, there are significant changes visible in the prefrontal cortex, which is involved in the decision-making process, in your cognitive control and things like that. So therefore, your brain development is basically significantly happening during this phase. Now, one important thing, I think we have discussed it, but I want to highlight few things about the hormonal basis of adolescence. Now, we have already learned it that it is linked to the secretion of sex hormones in the boys and girls. Now, we know male sex hormones is testosterone, they are secreted by testes. Female sex hormones, which is called estrogen, they are secreted by ovaries. Now, how these function is also a major factor that it's important to be started during the adolescent phase, especially, there are the gonads, they function through the hormones that are released from the pituitary glands, and pituitary gland is basically regulated by the enzyme released from the hypothalamus. So that mechanism needs to be understood. So that is what we'll be talking in the next slide. Now, these FSH and LH, which are the hormones released from the pituitary glands, these are basically controlled by hormones of a specialized region of your brain called hypothalamus. Now, hypothalamus secretes a hormone which is called as gonadotropin releasing hormone, GnRH, which is again controlling the release of these hormones from your pituitary glands. But the role of hypothalamus is exactly on your pituitary glands. When these releasing hormones are secreted from hypothalamus, they are regulating your pituitary glands, and this release basically happens under certain conditions, under certain external or your internal factors, internal signals that are given to your brain, and then only these hormones are being released from hypothalamus, which affects your pituitary gland, causing the release of your gonadotrophins. Now, these gonadotrophins, which are FSH and LH, they act on your gonads, and therefore your release of sexual hormones happens respectively in both the genders. Okay, so that is how the mechanism of your hormonal basis of your adolescence phase. These internal and external signals are again very much individual specific. How they are regulated, again depending on the external conditions, but only with the presence of these signals does these hormones come into action, and therefore your gonadotrophins are regulated. So that needs to be very much clear. Now, in terms of your brain development, for girls, when we see your brain reaches largest physical size around 11 years of your age. For boys, the brain reaches its largest physical size around 14 years of age group. It does not indicate, the brain size is not implying on your smartness or your IQ level, because it is different for males and females both, but it is only implying that how your brain is in terms of development phase, how it is maturing gradually with respect to its size, and how proficient it is becoming in its functions. So all these things are basically understood. Now, this figure basically depicts a clearer picture of how your brain is reaching its largest size in the early teen years, but it continues to mature well until you reach your adulthood, or you are into the adulthood phase. Okay, you come out of your adolescence phase. So this is quite a clear graph of that. Now, in terms of your intellectual and behavioral development during adolescence phase, see, early adolescence, there is a capacity to develop for logical reasoning. As we have discussed in the late childhood also, the child is constantly questioning. It also depends on how your peer network is, how your academic performance is, how the environment in your school is. That helps you develop that habit of reasoning. Your brain is sort of say involved in many logical questions. So that capacity is developed during this early adolescent phase. They have a enhanced awareness of themselves, their ability to reflect on their own being. Now, that is again very much individualized. It also depends on how the nurture or the care is given around that particular child or that adolescent, right? So for example, a traumatic child would have a different experience of realizing himself or herself with respect to a person who is being given many facilities around him or her in terms of music, dance, physical activity, sports, things like that. So that child would be realizing himself or his or her own interest in future that he want to pursue with respect to a person who has been in a traumatic conditions early in the childhood, right? So that difference is basically visible and is reflected by a child himself as a part of their behavioral development in early adolescent phase. Now, there are quite visible physical changes. We have already talked about it. They become self-aware. They are self-conscious. Also now here, because there are a lot many physiological changes, so a person observe these changes within themselves. They become self-aware of it. They become conscious about what is their physical appearance like. And in terms of the eating disorder I was referring to, it is again in terms of their physical appearance that because of the ongoing trend. In fact, if you go by the current trend, the keto diet again becomes one of the factor that most of the young girls, adolescent girls, pubertal girls in their pubertal age, they are worrying about their physical appearances. They do not want to gain weight, and that is again a factor that is, if you talk from the public health point of view, it is a factor of worry, or that age is quite important for your physical development, for your bone development, for your muscle development. And if in that particular age you are not taking up food, even though you have a good food availability around you, so that becomes a major public health problem. Okay. Public health problem as in not just in terms of your physical development, but also you are now more prone to, your immunity is at risk, you are prone to more infectious diseases or even lifestyle disorders. So that becomes a challenge from public health point of view, right? So when they are becoming self-aware, self-conscious, they're worrying about their physical appearances, their attractiveness, and their increased sensitivity to these differences and worries, right? So that's reflected in their behavioral development. Now, one important thing is observed in terms of their moral learnings. Again, your peer network, your social environment has a major impact on these moral learnings. Younger ones might have acceptance to these social norms, but as and when you proceed with your adolescent phase, you try to question any behavior around you. You try to reject the, so to say, cultural traditions that people are blindly following. You tend to develop your own ideologies, your own understanding about something, right? So that awareness, that consciousness about something happening around you, that curiosity to know, and curiosity to question it, logically reason it, is is inculcating in you during this phase. Also, as I talked, that depending on how the nurture is provided to a child in their late childhood or early adolescent phase, they identify their area of interest, their strengths, their weaknesses. During adolescence only, they are more concerned about what could be the possible career options they could stick to or they could explore about it, right? Most of us do not know still, but that phase, because it's not just you but also your family that is questioning what is your interest. Later in your higher classes, you are questioned about what could be the possible future option that you're looking forward to, because again, depending on your interest, you're depending on your network, your understanding, your interest. All of these are basically questioned around you, and then you yourself develop that idea of career options. Again, therefore, the role of parents, role of teachers, peer groups, clinicians, all of these become very much predominant. Anything in your social environment during the adolescent phase is very much crucial in because now, see, as I talked, you are becoming more self-aware, you are becoming more self-conscious, your reasoning capacities, your reasoning capabilities, all of these are grooming up. So anyone around you talking nonsense or talking anything that you do not understand, they'll be questioning it, they'll be contradicting you, you will be contradicting them. So their role is very much important in helping that behavior settle in both the sides, right? So you have to give a clear explanation of why this is being done to them, or why their role is very much important in particular setup. So therefore their role, their perception matters in the adolescent development per se. Most importantly here, the adolescents are exposed to a lot of adverse behaviors. If you see, for example, Urta Punjab, you would have seen there is a good example of how young youth is very much into the behavior of drug consumption. Then there are also adolescent sexual practices that is being very much highlighted as, and is also coming up as a public health problem, so to say. So this become these exposures and these behaviors again become a risk for adolescent health and well-being. Apart from that, emotional development, sometimes this phase is basically understood as a spontaneous outburst of emotions. Now this outburst could be sadness, it could be anger, your fear, your anxieties, aggression, or empathy towards something. So these behaviors, there is a sudden outburst of these emotions, right? Now it is not they are wrong or the other party is wrong, no, but it is challenging for the other person to understand what the behavior is exactly. So now they have to understand it and reciprocate in the same manner. Otherwise it would be very challenging to face the repercussions, because that could aggravate to a that expression could go beyond limits. So that becomes a challenge for your peers, your parents, and your teachers, so to say, to face the repercussions of that outburst. Sometimes communication is also difficult, and it gets worsened when the families are divided or the parents have emotional problems of their own. In this stage, basically the clinicians or the parents, they can be very helpful in offering quite sensible or a very practical, concrete sort of advice or supportive advice while they are communicating to that child or communicating to the whole family, so to say, right? Therefore, emotional liability is a direct result of these neurological development during this period as a part of brains that control emotions mature. Okay, so because again that's in a phase of maturity, your neurological development is also affecting your mood disorders or your mood imbalances, your emotional outbursts. Now, okay, yeah, so I have already discussed that these could be a sudden outburst, and frustration is again one of that domain that we are talking in terms of the outburst of emotions. With that outburst, there could be a conflict of opinion. Adolescent conflict is understood from adolescents' desire for more freedom of expression, freedom of exploration, so to say, and that has a conflict, that has a clash with the peers' instincts or your relatives or your parents' instincts, because here the clash of opinion take place. Your intellectual development, your emotional development tend to invite you to explore things in every possible aspect around you, but that clashes with the parents' opinion that this is wrong or this is right. So still they want to explore it because they want to have an experience of themselves. So that conflict is basically what we see. Like if you go back to your adolescent phase, you will realize what kind of conflicts you have gone through during this phase. That was a part of your emotional development plus your neurological development, because your brain is looking for new experiences, new explorations, things that you can learn by yourself, right? Because as a part of learning behavior, as a part of learning mechanism, your brain is acquainted to either learning by writing, learning by reading, or learning by discussing. And discussing is a part of learning by speech. So learning by speech, as in you are discussing or you are talking to someone, you are exploring or you are presenting yourself. So that is again one form of experience. So that has implication on your neurological development and therefore your behavioral development. So that again is understood as a part of adolescence development. Apart from that, there are social and psychological development that takes place during adolescent phase group. more than your own family, parents and siblings, your peer is where you are comfortable sharing your opinions. You share your likes and dislikes, be it your dress culture, appearances, hobbies, interest, anything. So you are free to express all your likes and dislikes with your peer groups. Without those peer groups, they have intense feelings of being alienated or being different, and they may consider it as an antisocial behavior, right? So therefore a special screening is required to identify mental disorders like depression, bipolar disorders, anxieties. Although it is not an antisocial behavior, but they think because they do not have a peer group, they do not have a close friend network, so that is considered to be as an antisocial behavior for themselves. And in the same age group, their own friends or those with whom you have the conflict in that age group, they also think that it is not cool to have to not have a peer group, right? You may be comfortable speaking to your parents, you may be comfortable speaking to your siblings, to your relatives. Therefore you need not require a sort of say peer group. That could be one possibility. You do not feel to express yourself to somebody, but you want to express yourself by writing. So that is one possibility of being an individual. That's an individual trait. So within that age group, you try to understand this as an antisocial behavior. When we talk from anthropological point of view, lack of social interactions again is a part of antisocial behavior, because you do not have interactions with people, you do not have any social bondages, you do not have any social function, you do not contribute in society, things like that. But apart from that, when you have a space to express yourself, whatever comfortable space that could be, that depends on your individual choices. So that is not an antisocial behavior, so to say. But what we see is this kind of behavior is associated with lot many behavioral disorders, or your neurological or mental disorders, so to say. So therefore a special screening is done during adolescent phase to identify any form of mental disorders, like depression, bipolar disorders, anxieties. And also, if you see, the suicidal rates are quite prominently visible during the adolescent phase. Now, apart from mental disorders, there are the psychotic disorders like schizophrenia, which is usually identified during the late adolescence phase. Eating disorder is observed, such as anorexia nervosa, bulimia nervosa, etc., which are relatively very much common among girls, especially during adolescence, to tackle that challenge of having a good physical appearance, to tackle the weight gain issue. So they are consuming very little or not consuming at all. So this is again one of the significant thing visible during your behavioral and your social development in adolescent life. Typically, substance abuse is also observed during adolescence. We have already talked about the drug consumptions, and apart from that, there are also other substance abuses visible during adolescent. Thus, your peer, your parents, your relatives, they set a good example in front of children and influencing their behavior related to alcohol, drugs, any form of learning values, even your sexual behavior. So these things needs to be taught and trained by your teachers, by your parents, and any network that you are into, or your clinicians also, so to say. So their role becomes very much important in a very holistic development, right? Now about the sexuality. We know that role of parents and peers become important, especially in terms of setting your sexual perspectives. For instance, homosexual adolescents may face unique challenges with respect to their sexual maturation. And just a disclaimer, most of the researchers need to bring out that evidence from anthropological point of view, how that development of homosexual adolescent is actually being impacted. There is a very limited literature about it. So that needs to be taken into consideration, because firstly it's a very socially, legally, it even if it becomes legally acceptable, socially accepting it is a major challenge in Indian society. So what kind of challenges do they face in terms of the sexual maturation, is very important to be understood from research point of view, right? Now, peer pressures basically are leading to stressful conditions for a growing adolescent, be it in terms of your career options, be in terms of your academic performance, the antisocial behavior that we're referring to, bullying by your friends, physical violences, any form of threat, or for example, your physical appearance not being good. Girls are being fearful of your physical appearances. Even boys, for that matter, are becoming that trend is setting up gradually, where boys are considered to be they have to be in a socially accepted, sort to say, that physique, right? So therefore, these social acceptances, these social threats are basically posing stressful conditions for the development of an adolescent, so that struggle persists with respect to one's social identity. Therefore, it is very much important to encourage these adolescents, give a correct guidance towards their sexual behavior, their sexual perspectives, their own sexuality, so to say. So these encouragements, these education, these imparting knowledge needs to be done during adolescence. Talking about the health during adolescence, this being the last slide. Adequate nutrition is very much important for your optimal growth and development. As I was already talking, even though you are concerned about your physical appearance, girls are being crazy over their food, their dietary practices, but still, this is the phase when you need to develop your good physical growth, your optimal growth and development for your body, because here risking your body is also risking your immunity, and further on inviting infectious diseases and things like that, lifestyle disorders, so to say. So therefore, your dietary choices, your habits influence your health patterns, your health behavior. Anxiety about your body image or body satisfaction with your body masses, or issues like muscle dysmorphia, anorexia nervosa, these are all eating disorders, binge eating, these are all patterns of eating disorders which are predominantly visible in adolescence, and these needs to be catered for when you're talking about with the public health perspective, so to say. There are eating disorders which would lead to CVDs. There is an increased risk of heart failure, osteoporosis. These are the impact that you could visibly say about eating disorders. Here again, you will be having very much lifestyle issues, as I was talking. It's not just about the eating or controlling your food, controlling your diet. There are situations when you see a visibly thin physique of a girl because of eating disorder. Now, this age being more prone to your immunity infections, or your you have to have a good optimal growth and development. So if you're risking that optimal growth, or so to say a minimal growth for that matter, you are risking your further coming years of your life, not just with respect to risked immunity, but also risks to different lifestyle related disorders that happen time and again with respect to your physical and social environment. So these things are basically very much important to be looked after from a public health perspective, from anthropological perspective. And when we're talking about adolescents, definitely the broader area of research that could be looked after is the homosexuals growth and their development, and how the social norms are affecting their behavioral development, their cognitive, intellectual development, their psychological, psychosocial development, so to say, and again impacting on their health. So how these constructs could be really important and could be really interesting from research point of view. Yeah, so this is about adolescence. We'll sum it up here, and in the next session we'll be talking about adulthood. Okay, thank you.